Hey, this is Dr. Keith Hersey, and you are listening to the Destroying Diabetes podcast. Well, thank you, everyone. This is Dr. Keith Hersey. I'm your host of podcast Destroying Diabetes, and I welcome everyone joining us today. Just like to thank everyone for their continued support and just continue with your calls, your emails. Best of all, subscribe to the podcast, share the podcast to a friend or family member that you think that could benefit from it. And like I said, the great thing about this podcast is that as long as you have an internet connection, you're able to listen to it throughout the world. I'm still waiting for my first email from a foreign country yet. I haven't got one yet, but I'm looking forward to that at some point. So feel free to send me an email. Just let me know that you're listening. Or if you have a family member listening somewhere, just let me know. I'm just glad to have that. And so I'm just like I said, I'm just so thankful that you're taking a few minutes out of your day to listen to me rattle on about diabetes or anything else I come up and talk about. So, and I guess I must be doing okay because they let me back in. They didn't lock the doors again or didn't turn off the microphone. So I'm assuming that I'm okay. I'm just one day they may just lock the doors and just be like, well, we don't want you to hear from me anymore. So that hasn't happened. So well, today I'm very fortunate to have a very special guest, Dr. Ahunna Freeman. She is just a superstar. She is the one of the owners of Southside Discount Pharmacy. And she has been practicing for over 15 years, about. And she has had her own pharmacy for a little over 10 years. So I hope one day to get to that point. Now, I'm not quite there yet, but hopefully one day I'll get to that point. But anybody that has an independent pharmacy, it's just a challenge, and to be able to have it for 10 years is just a testimony of just great work. And so I would just like to welcome Dr. Freeman to the podcast. I'm just glad that you're able to take a few minutes out of your busy day to join us.
Absolutely, absolutely. I'm so happy to have the opportunity to be here with you and sharing this space and your wonderful podcast and platform with your audience and listeners. I'm excited to be part of this journey that you're in. I love it. Thank you for having me.
Oh, it's no problem. The thing that we're discussing today is just that I know that you've done a lot of work with diabetes and education and working with your patients and healthcare providers. I just wanted someone that gives some insight besides myself, just as far as um, just talking in general, as far as with your work with diabetes patients. How did you get started on it, and why did you decide to kind of concentrate some of your effort toward that, and how long have you been doing that?
Yes, thank you so much it's an important question that you're asking me, Dr. Hersey. I appreciate that. And I feel like the audience also would appreciate that. I have been in this independent journey for 10 years now. And, been in the pharmacy space as a community pharmacist for over a decade. And just like you, I'm sure you're very aware of this. We have a lot of patients in our own respective communities that are struggling with diabetes. And not only are they just struggling with diabetes, they're struggling with the basic stuff that I know myself, I'm guilty for this, but struggling with the basic stuff that we take for granted I assumed a lot of times that patients, oh, they know this, or they know this by now, or they're not a first time, they're not newly diagnosed diabetics or patients with diabetes. So it's because they've had diabetes for years. We're thinking, or I'm thinking that they know that they have it down. But a lot of times when we actually stop and listen to the patients, we realize that, okay, we really need to show them and guide them on things that can help them gain the outcome that they're looking for truly, especially for the patients that are engaged. So my passion in this area of pharmacy and community pharmacy, I have to say, just started with the other passions that I have within my pharmacy. And it comes down to patient education and health literacy. When I worked in the bigger retail spaces, I wished all of that for every single one of my patients, but I only had so much time to be able to really engage with these patients that truly needed help and to be able to show them and guide them on what they needed to do. So when we opened up the pharmacy, we started right away. We built the pharmacy, we set the foundation, knowing that we wanted a clinical community pharmacy where people can actually stop by and get education on disease state or medications. And that's how we all started, to be honest. And going along on that path, we also discovered that that's a path that is hard for us to be able to sustain. And to be very honest with you, I'm more than anything grateful for the partnerships that we formed along the way. And I have to give a shout out to Diabetes Smart of North Carolina, DHHS. This area of the department in North Carolina, Division of Human Health Resources, so services, however they say it. But that division has really supported our journey into diabetes education. So with their support, we were able to gather resources that we used on a lot of our patients that needed help understanding diabetes, finding their way, navigating through the process of diabetes, not only with medication, but with education, with physical activity, with navigating the system just to obtain guidance on everything they need to support their diabetes care. So that's how we started, and we've just been doing that for many years now. And at this point, it's something that is expected. And as the care for diabetes continue to evolve and transform, more technology is being added to the care of diabetes. And, our patients are also getting older, and some of them are not so used to what they've always been used to. So it requires also more time to sit with these patients and help them. So knowing with the patients, knowing that we can provide that, that's really how we've continued to move on. And that's how they've continued to support our work as far as diabetes goes in our community.
Okay. Well, that's great, and I'm sure that your patients are very thankful for the services that you provide, and just having that type of resource in the community is uh, just such a great resource just to have. So,
Absolutely.
thank you again for providing that, and like I said, that we're kind of on the we're just in the trenches, right? Right. We have more access to patients than anybody else.
Yeah.
So just being that resource for patients is just so important. And I'm glad to see that you're doing that. And what I'm trying to do as well is just trying to move into that more realm, really back into healthcare, helping to create wellness with our patients, not just medicate them,
That's
medicate
correct.
them. So,
Yeah.
so um, anybody that works and does that in this space, that's just extraordinary, and we just really thank you for providing that. So, what would you say if you know, that you see with your we have like diabetic patients and people that have family members that are diabetic patients. how do you approach like when you have like a newly diagnosed patient comes into like your pharmacy and they need help? What do you recommend for them?
Yeah, definitely. When patients are newly diagnosed with diabetes, a lot of times it's overwhelming first. And, in my situation, in my community, a lot of my patients that are newly diagnosed are diagnosed in the emergency room. And sometimes, most of the time, to be honest with you, they don't even have any type of insurance. And they come in with, and I'm talking about when insulin was $500, right? Because, this is 2024. We turned around, moved it to 2024. And oh my goodness, most insulin are now less than 150. That's a miracle. So in those days when insulin is over $500 and these patients are walking in, and a lot of times they're not even our patients, but someone had told them word of mouth, or the pharmacy named Southside Discount Pharmacy. Maybe they moved the prescription from wherever else that's quoted them a high cost. So they see the name and they come in and they're trying shopping around just to see if they can afford it. How I approach that is I always try to remind them that managing this diabetes, this newly diagnosis that they have, is not just about that medication. Like you said, it's all about the wellness in general. Otherwise, if they're able to afford the insulin today, are they planning on affording making that payment every single month, along with all the prescriptions that they have that just comes with diabetes? From when you get that diagnosis, sometimes you go from 0 prescription to 5. They're thinking of something for your kidney protection, you're like Cinepro for heart protection. They're throwing aspirin for cholesterol, and they're throwing metformin. And depending on how your A1C is reading or how your blood glucose levels are, there's the insulin. That's 5 already. And you just get the diagnosis, right? So how I approach it is to make sure they understand that it's all about a wellness journey and not just getting the medication, because what is going to happen, they're going to take the medication, they're going to feel better, and they're going to stop paying for the medication. They're going to stop treating their diabetes. So we always offer the opportunity to take on our diabetes education that we provide. We try to make it very affordable, but we did it in the beginning as a free service. But we know free service is not always the best way, because
Yeah.
you have the appointments made, you set up the time, you have a translator. I have a lot of Spanish speaking. Sometimes I don't need the translator if it's English speaking, but then the patient doesn't show up. So making sure we put a price on that, and giving them the option to attend any of the sessions that we provide one-on-one. And I guarantee them, you sit with me, you choose whatever session you want, which I've broken down into at least, like, I think 7 of them. And all of those, if they choose, each session is $30. That's very reasonable. And we can dive into how they can take on with this diagnosis. It's not, it's up to them to think about it. It's up to them to start today, right away, when they come in. But it's up to them to also leave it alone, and we'll see how it goes. Either way, we always make sure that we're there to support the patient. And if it's a patient that's absolutely not able to afford that, or even if they can afford that, but they're looking for other options, we always keep resources around, because even though we may serve the community, we may not be able to serve everyone. So we make sure we have the resources for them to look into, that they're able to attend to in the community and take advantage of it. And I can tell you, a lot of times patients do take advantage of that. And I also mentioned to them that the diabetes that they have now as a diagnosis, they should definitely look back into family history. And a lot of times they already know that. And they're like, well, my grandma has diabetes, or my dad has diabetes, or my spouse, and the whole family, my mom, they already know that. So it comes as a warning sign for everyone, not to scare them, but it's just to try to prevent anyone else going through the process, or prevent anyone else to go through that process. So we attack the wellness arena of diabetes. And then we also bring it to their attention that this is something that can be prevented if possible. So that's how I approach it.
Okay. Well, that's great because a lot of it just when someone's really like diagnosed, it's a lot of times there's a lot of confusion. People are upset, you know, they feel
Depressed.
guilty that they're depressed about how they felt like they allowed this stuff to happen, especially when they have a family history of diabetes and like I said, just like even like myself and my own journey with diabetes, I was in denial when I was first diagnosed. So I couldn't believe being a pharmacist that I would have type in the family history, strong family history of it, that I would be diagnosed with type 2 diabetes. So yeah, just being able to move patients from that state of denial and depression and being upset to being able to be an advocate for themselves.
Yes, absolutely. And I can definitely relate to that because that's exactly, absolutely how it happened with my own dad. You know, like he's very healthy, he does everything, but like it doesn't even, as far as we know, run in their family. It runs in my mom's family. But both my parents are in the medical field. When my dad found himself using the bathroom more than necessary, I'm sure it struck a light bulb in his head, but he kind of denied. But it was actually my mom that said, "Are you sure?" Oh, just her mentioning it made him very upset. Like, what do you
So
mean? It can't
yeah,
be. And she
yeah,
said, but sure enough, and it was, and he was in denial, but he really got to the stage, like you said, moving out of that stage, knowing how to advocate for himself and taking the bull by the horn and doing everything he should to just get back to a controlled state.
yeah,
Yes, that's something patients just have to remember. You're down, but you shouldn't stay down.
yeah, 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 yeah. And so, what is your feeling as far as now the biggest thing that's coming to market is that we have all of the new um, weight
CGM.
loss drugs, so dealing with all those, the Ozempics and Wegovy's, and how do you handle that with your patients, or your patients are on that, or they ask about it?
Well, yeah, that's a good question. I get this question a lot, and I address it. I love addressing it. I mean, it's the wild, wild west out there with GLP-1s. And for patients that have diabetes, there are two, there are two types of them. Okay. So they're the patients that actually have diabetes that have been put or considering to be put on the GLP-1s, right? And then they're that can afford it. And then the patients that need to be on it, maybe they've considered putting them on it, but they can't afford it. We have to remember the co-payments are different. Um, so when a patient approaches me, I had a young lady actually approach me. She actually had diabetes. And of course, it's all over social media, Ozempic, but she told me, she said, well, I really would like to hear what you think. And I'm like, what is it about? Her provider's considering putting her on the Ozempic. And, you know, I know her personally as one of my patients that she's doing everything she can to really manage her diabetes. And sometimes we can do everything we can, but our genetics and hormones just won't let us be great, right? And that was her situation. And I asked her, if this could help you overcome this big challenge, what are you waiting on? And why are you nervous about that? Of course, it's the misinformation out there about the GLP-1s. It's been blown up. GLP-1s have been available since 2005, I think,
Yeah,
with Biduron or Byetta,
yeah,
right? And it's being modified to get better and better. And now we're seeing the benefit. So how I feel about it is they need to make that affordable for everyone because there's
yeah,
a benefit to it. If it's just for obesity, they need to make that available because why do we want these patients to tip into the other side of that from pre-diabetic, from being pre-diabetic to becoming patients that have diabetes. And now they have just going from one medication that they could use to a whole list of them that I mentioned earlier. So I think it's a good thing that these medications are available. And I can promise you right now, this is not the best of the GLP-1s that we have seen. The best is yet to come because the original ones, no one is even talking about them. They had results, but their results, I guess, wasn't as great, obviously.
Yeah.
It's getting better and better. So in the future, it's only going to get better. So we might as well just embrace this and help as many people as we can, because that's only going to drive the mortality of diabetes down. It's going to encourage more patients to take control of their diabetes, and it's gonna help a lot of people. But the mistake that we would have to make, or the mistake that we can make, is not pair it with lifestyle, regardless of the indication. Obesity, diabetes, it doesn't matter, because you and I know, Dr. Hersey, as a pharmacist, what is lisinopril that a patient brings into you for the first time? We sit there, we talk to them, we counsel them on what to do. And a lot of times, patients, at least for me, will ask me, do I have to be on this forever? They're asking the same question with these injections.
Mm-hmm.
So when somebody brings lisinopril, I hope you're not planning on being on it forever. So what can you do to make sure that the doses don't keep escalating, or that you don't stay on it forever? We want you to get to a state that you can manage it with the least amount of dose to get the most benefit from it. Same concept, same way. That's exactly how I feel with the GLP-1s. So I'm all for them. I want every patient that needs to be on it, that can benefit from it, to be on it, that meets the criteria to be on it. And I hope every one of those patients are also putting skin in the game and making some lifestyle changes, and that could also include psychological help. Sometimes it's not just about nutrition and physical activity. So
yeah, especially if you're dealing with stress and trauma, and
exactly,
and you're doing a lot of emotional eating
exactly.
that's wrapped into that. Yeah. So dealing with that as well is a big thing.
Yes, because you can't outrun your emotional eating. You can't outdose your emotional eating. You can't modify it really have to, again, it comes down to getting to the root of the cause, and just seriously managing it, and with the support of the right credentialed professional.
Yeah. So what would be just again, I just thank you for taking some time out. I know, like, both of us had busy days. We talked about it before we went on air. What would be your message to people that they've had diabetes? They seem like they're adding on medications. Um, they're worried about, the increased cost, and increase may they may experience increased, side effects with the adding on the medications. And what would you say to that person to encourage them, or would you have them, someone that's a loved one, say to that person to encourage them?
Okay, so if you're listening to this message and this is really what you're dealing with, my message to you is, you or a caregiver, take advantage of a trusted professional that you have in your corner. The pharmacist, I know I'm biased, is the easiest accessible one. Most pharmacies' doors are open. Even if you have to make an appointment, the doors will be open. No one will stop you. You will speak with someone, but you have to build a relationship with that pharmacist and make sure it's somebody that you trust. And with this, whoever this person is for you, a healthcare professional, make sure that you're also ready to invest in yourself to make the changes that they're recommending. because making those changes might be very beneficial and will have a better outcome for you. Because as a pharmacist, I understand the concern of adding more medication, escalating the doses, dealing with side effects, and then adding more medication for the side effect, and the list keeps going. Most of us pharmacists don't really want that for our patients, believe it or not. Even as independent pharmacists, you and I, most people are like, well, it's more money. No, it really isn't. You and I know filling the
Yeah,
prescription
yeah,
sometimes it's like at
yeah,
a loss,
yeah,
right?
yeah,
So we don't want that. Speak with a healthcare professional. Make sure you understand how to take care of your diabetes, your own patient care, understand the education behind the diabetes, because how I always said, if you don't understand the nature of the game, how are you even gonna play by the rule, right? If you don't understand the
yeah,
game,
yeah,
how are you gonna play by the rule of the game?
yeah.
So knowing the game of diabetes will help you play by that rule so you can win that game. And it all starts with making sure, like making that first commitment to yourself that you're going to do it. Because we can tell you everything, we can give you the handout, we can show you the roadmaps, but sometimes it's harder to do, and you need the support and somebody and the guidance to help you get through it. So speaking with someone, understanding what's being said, and asking questions, coming to this session prepared to ask questions and walking away feeling empowered, that's the best way to make sure that you're taking care of yourself when it comes to your diabetes care.
Yeah, I definitely agree. I definitely agree. There's a lot of words of wisdom there, and I hope that our listeners and people that are watching this will take advantage of that. And
Yes.
this is something that it's multifold. It's a lifestyle issue. It's more than just the condition, the disease itself. So you
Mhm.
have to kind of treat it holistically, not just taking the medications, but also a lot of it with dealing with mindset. You may have to deal with some other issues that you might have not been aware of before, and how your relationship with food and things that may factor into your eating patterns and stuff, and being able to incorporate physical movement in your life, and so just it's a lot, and just having the guidance of a trusted healthcare professional, whether it's pharmacists like us, or nurse practitioners, or dietitians, nutritionists. Usually it usually takes a team of people that can be there and support you through this. So don't be afraid to ask for help or ask for support, because there is support available. A lot of it you just have to ask. So um,
And
and
may I ask, especially for type 2 diabetes, because you go from living just your normal lifestyle, enjoying yourself, and there comes this diagnosis, right? In your adulthood or adolescence age.
yeah, yeah. Well, Dr. Freeman, thank you so much for paying a visit with us today. I've gained a lot from it, and I hope that our listeners gain as well. And we will just thank you for just spending some of the time with that, and just displaying some of the just words of wisdom. And I just hope that people take it to heart. And we again thank you for participating with us today.
I appreciate it. And let me say one more thing, because in the
Okay.
beginning you did mention that you get the messages and you're yet to get a message internationally. So to the audience listening, if you're listening from out of country, out of the US, send Dr. Hersey a message. Just tell him that you heard this, especially if you're a Nigerian. Show
Yeah.
me some love. Show me some love. Give him a message, or tell us something that's been valuable for you, or maybe tell us how things are a little different back in your home country if you're not from the US, or if you're not in Nigeria. We want to hear. I'm also curious, and I would love for him to get something, international message from a listener. Nigerians, don't disappoint me.
All right. You heard it. You heard it
Thank
there. Now, you said I definitely will let you know, and let our other listeners know.
Yes.
when I get that first email or message.
Yes. Let me know. Thank you so much, Dr. Hersey, for having me on this platform. I appreciate the time that
All
you're
right.
taking to
All right.
educate your patients on this.
All right. Well, thank you so much for agreeing to appear with us, and hopefully don't be a stranger. Hopefully we may have you again in the future. So,
Oh, yes. That'll be fun. Thank you.
all right. Thank you so much. Okay, just again, thank Dr. Freeman for appearing on our podcast today. And like I said, if we want to get feedback from the podcast, free feel free to email the email that's in the show notes. Um, we really appreciate that. And like I said, best thing, share this episode with a loved one that has type 2 diabetes that could benefit from it. Also, subscribe to the podcast. And if you want to feel so inclined, give us a 5-star review as well. And just giving the reviews and subscribing to the podcast that helps spread the word out as well. And share it on your social media as well. Just follow us at Hersey Pharmacy. We're in Facebook and Instagram and Twitter. So just share our information. We will have links to the podcast as well in our social media. So if someone doesn't usually listen to it, we will have links as well. So as long as you're following us, you'll have access to the episode. And again, thank you for listening. Thank you for being there, spending some of your time out of your busy day to listen to us. And I just wish for you just to continue to be healthy and be well. Thanks.
Thank you for joining us on this informative journey. The content of this podcast is solely the professional opinion of the host for informational purposes only. It should not be considered a substitute for professional medical advice, diagnosis, or treatment. If you're experiencing any health issues or concerns, we strongly recommend that you seek the counsel of a qualified healthcare provider before making any changes.